Good morning, everybody. Welcome to Bringing the Zoo to You. I'm Dr. Mike Atkinson, and we are here today in the zoo's animal hospital. And today we thought we would do something a little bit different. This is the zoo's pharmacy, so all of the animal medications that we use here in the zoo are in this room, and our team is always very busy sending medications out to the different areas of the zoo for the different animals. And we thought we would just spend a little bit of time talking today about what goes on with this and some of the different medications that we use with the animals here at the zoo. You'll notice right off the bat that we've got a wide variety of medications that we have here in the pharmacy, and they're really a mix of both veterinary products made for animals as well as human products. You'll note right off the bat here, some products that you've probably got at home in your cabinet in your bathroom, some Dayquil, some Dimetapp. We use a lot of these same medications that you or I would take with some of our different animals here at the zoo. So we thought we would just kind of talk through some of the different uses today, and then also all of the steps that we have to go through in making these medications something that we can get our animals to take. So I think anybody that has a pet dog or cat at home, or anybody that has a 2-year-old at home, can probably relate to how challenging it can sometimes be to get your pets or your small children to take their medicine. And we face all of those same challenges here at the zoo. If anything, they're sometimes even worse than what we deal with our pets or our children, just because of the nature of the animals we work with. One of the things that we thought we would start off with here is just showing the difference in the size that we deal with. So what we've got here is amoxicillin. So this is a common antibiotic that many of you have probably taken yourself at some point in your life. And Michelle, one of our veterinary technicians, set up a couple of examples here just to show you. So this is the difference that we deal with. So if we're dealing with a calamico, we actually have to take these capsules apart. So what you or I would take at home is just a single-use capsule that we swallow. We actually have to pull these apart, take the powder out of them, and then weigh that powder out to get down to a small enough dose. So this little small amount of powder here is what we would give to a calamico, or one of the really small little marmoset monkeys that we've got here at the zoo. And our techs have to package these up, and they make these little packets and fold those up, and then our care staff mix that in with the food for the animal. On the other end of the extreme, if we step over here, this is a single dose, a one-time dose for Layla Rhino. So instead of just taking one capsule, this is what Layla would be taking, and this was 42 capsules that Layla would have to take for one single dose, and she's going to take this twice a day. It's a lot of pills, but obviously she's a big animal, and we can pack that into some kind of food treat that she takes really readily. So just to kind of illustrate the difference of complexity that we have to deal with there in terms of getting these meds situated for our animals. You'll notice Michelle over here is actually measuring out doses of Altrinagest for one of our animals here at the zoo, and in this case it's a paste, and we actually have to fill this out into individual dose syringes for our animals here at the zoo so that we can safely send these out of the hospital to be administered to our animals. So in addition to all of the work that our veterinary technicians do in the daily care for our animals and all of the hospital operations, they also play the role of pharmacy technician in the back here, getting these medications ready to go out into the park for the different animals. So we talk a lot about all of the different roles that our vet techs play, and what an incredibly valuable asset they are for us here at the zoo, and how much we're very blessed to have such an incredible team of technicians working with us every day. So just some other kinds of medications that we use. If we come back up here to the cabinet here, this is actually just our sort of non-steroidal anti-inflammatory drugs. So this would be some pain relief, acetaminophen. This is one you've probably got at home, and then also children's Motrin or children's Advil. In addition to that, there's also a variety of medications that are made specifically for animals that some of you even may be familiar with, as far as Bute or Firocoxib that's for horses as an anti-inflammatory. So just a wide variety of different pain medications. One of the things we deal with a lot of our older animals is arthritis, and we talk a lot about the same type of degenerative problems that older people may develop in their joints. We see that with a lot of our animals, and we use a lot of these what we call NSAID drugs in order to keep our older animals comfortable as they develop those degenerative arthritis pains. in the next set here, just to kind of keep moving through some of these, this is a variety of antibiotics. Many of you probably at some point in your life have been on a number of these different ones, but we've got some of these oral suspensions that kids at home often take. So these mix up to be like a bubblegum flavor, usually, which some of our animals love that bubblegum flavor. A lot of our animals don't like that bubblegum flavor. So we also do a lot of flavoring with the different medications. Some of the things may go out of the pharmacy here flavored like fish or flavored like beef, or things that you or I probably would not want to take if we were sick at home. I think the last thing I would want to be on at home would be a fish flavored medicine if I wasn't feeling well. But for many of our animals, that's a really appealing flavor that they may be interested in taking their medicine. Some of the other products that we'll see as we keep moving along is we've got all sorts of antihistamines, cold and cough medicines. Every so often we deal with the same type of cold and flu symptoms that you or I have in our gorillas and our orangutans, so it's not uncommon for us to have them on a Mucinex product every year or so when they kind of get a wintertime cold, just like you or I might get. We've also got a lot of the same types of laxative and gastrointestinal medications that you might have in your bathroom at home, Pepto-Bismol, antacid tablets for animals that may get a little bit of a stomach upset here and there. Really just a wide variety of different products. Some of these are veterinary products. Again, this is a dog and cat medicine here that's used as an anti-nausea medicine. So some of you that have dogs at home that may get car sick may have that exact same product at home for your pet dog. We've also got products like ondansetron, that's a human product as an anti-nausea medicine. So this one's a common one that's given to people after surgical procedures, or women during pregnancy as an anti-nausea morning sickness medicine. So again, we sometimes go with the veterinary products, and sometimes we go with the human products just based on the individual species we're dealing with, and sometimes based just on what the animal prefers or what's more effective. We've got vitamin and mineral supplements that many of our animals are on. We're very fortunate here to have a full commissary as well, so where all of our animal diets are prepared. Dr. Jen Watts, our nutritionist, does a lot of the vitamin and mineral balancing of those different diets for the animals on a daily basis. And so we don't stock a lot of this in the hospital, but every so often we've got a case where we need to do an additional supplement, and sometimes it comes out of our pharmacy instead of the commissary. We've got a wide variety of ophthalmic medications as well, eye drops, wide variety of different eye drops for different animals. These can sometimes be a real challenge for us to get in, and we really rely very heavily on the animal care staff and the incredible relationship that they have with the animals in order to get these eye drops into the animals. This really takes a lot of trust between the animal and the care staff in order to get an animal comfortable with having eye drops put in. Again, if we think of diseases that sometimes develop with old age, we think about things like cataracts, we think about things like glaucoma or increased pressure within the eye. I know that, my grandmother, as she got older, was on glaucoma medications. My dog, actually right now at home, is on glaucoma medications. And those are some of the same things that we deal with here with some of our older animals, is the need to get those eye drops in to keep their eyes comfortable. We've got a great team of ophthalmologists that we work with as well that really help us out a lot with some of the different ophthalmic medications. One of the other things that we were going to talk about actually in the same area, or actually Michelle pulled them out down here, let me step down here. With some of our animals are on contraception. So for animals that we don't necessarily want to reproduce, we've got a wide variety of different contraceptive products that we use. In some cases, we get these things custom made and custom formulated. So this is for one of our giraffes here. This is a MGA supplement that's just a liquid that goes on the grain that the animal eats every day, and that helps prevent pregnancy in that particular animal. Some of the other animals you'll notice, this is basically the same birth control pills that a person would take. This one's actually scripted from Walgreens, who we have a great partnership with, and they supply us with a lot of different products as well. But just a variety of different products that we use on that front as well.
How do you administer some of these pills to animals?
That's a great question. So how do we get these different products into the different animals? It really depends on the drug and on the animal. So some of the products taste good and the animals are very compliant and it's easy to get it in. Other drugs have a really bitter or not pleasant taste, as most of us can attest to ourselves. And those take a little bit more work sometimes to get into the animals. So we do a lot of flavoring of medicines. We do a lot of trying to hide medicines in different food items for the animals to entice them to take the pills. And sometimes when we really are struggling and we can't get an animal to take something orally, we do have to go to an injection or a shot. So just like you or I, sometimes if we've got a lot of gastrointestinal disease where we feel sick and we can't keep food down, or we feel like we're going to vomit, sometimes we'll get an injection of a drug instead of an oral dose. We do the same thing with our animals here, and sometimes we have to give them those shots to get the medicine into them.
What's the most difficult species to medicate? For instance, how would you medicate a fish?
That's a good question too. So a fish it can be a real challenging one. So sometimes again we can hide the medicine in a food item and we can drop some sort of special treat in there into the water in front of the fish and get them to take it orally. Other times we can actually put the medicine into the water. So we'll take the fish out of the normal enclosure, put it into a smaller tank, and we can actually saturate the system water with the medicine and treat the fish that way. So that's just a couple of different ways that we can work with fish. As far as other animals that are challenging to get medicine into, it's some of our smartest animals can sometimes be the hardest ones to work with, and that gets back to usually our primates, our apes, and some of our smaller monkeys. They're just like us. They can pick things apart and they can pick out those tablets, and they'll eat the treat item and pull the pill out and set it aside, and eat the food item and leave the medicine behind. So just like trying to get a 2 or 3 year old child to take medicine, it can take a lot of work sometimes to get those medicines into them. Again, we rely a lot on our incredible care staff to really work with the animal and get them accepting of taking those medicines if it's going to be something that's on a routine basis.
So we do have a lot of animals who live outside. So do any of those animals get flea or tick medication?
They do actually. So we can actually, if you want to pan the camera around right down here, we've got a variety of anti-parasitic drugs in here in this cabinet. Some of these are oral pastes up here at the top. These are horse products here, some cattle products there that we use. Sometimes we have it milled into the pellets that the animal gets. So this actually is just a pelleted food formulation that gets mixed in with the normal grain that some of our animals take. And then down here at the bottom, as far as flea and tick products, some of the same things that many of you may have at home as far as Advantage, topical flea and tick medications. Capstar is another one that many of you may recognize. Revolution, Comfortis. We've got a variety here of both topical and oral flea and tick products. And for some of our animals, the fleas and the ticks are not really an issue, and then there's other species where it's something that we do have them on a monthly treatment for that. Same thing with heartworm. Most of you probably have a pet dog or cat at home on a heartworm preventative. We do the same thing here with a monthly prevention for heartworm disease.
You talked about Layla earlier. I know there's been a lot of procedures done with her. How do you give an animal like a rhino a shot?
Yeah, that's a good question. So in some of those bigger animals like Layla, sometimes we can get them to come up to the front and they'll station for the care staff, and if it's an infrequent treatment, we can often have them voluntarily conditioned to take those injections. When we think about usually the size of the injection that we're giving and the size of the needle relative to the size of the animal, it really is not something that hurts very much when they get those injections. So we can usually get them to sort of voluntarily participate in that care, where they'll come up, they'll station, and we're able to just give them a quick injection with the treatment. Sometimes they're not as cooperative as others, and we've got a dart system just sitting out here that I can also show you. this is just a routine blow dart that we use here at the zoo. So basically this lower part here is where the medicine goes, and we're able to put the injection in this part, and then this back part just gets pressurized with some air, and there's another little stopper back there, so you can see that this is what gets the air pressure behind the injection. And then when the needle goes into the animal, it releases that, and the lower part here would inject the medicine from the air pressure in the back, pushing it forward. And this would just go basically into this type of blowpipe here. And then there's a little mouthpiece. We all have individual mouthpieces right now because of COVID, so we've all got our individual mouthpieces there, and this just goes on the pipe like that. And then we would just basically stand back and blow the dart out of here into the animal. So it really doesn't hurt a whole lot more than just a normal injection would, so the animal definitely feels that needle stick, but it's usually not something that's a terribly uncomfortable process for the animal. And we try and minimize the use of this as best as possible and try and do as much under voluntary control as we can. But I think anybody that has pets or kids at home know that sometimes it can be a real challenge to get those medicines into the right place.
So you actually blow the blow darts. That's pretty cool.
Yes. So on a pretty regular basis, we're doing some sort of blow darting of some animal here.
The vet techs are really crucial to everything that the veterinary staff does here. How many vet techs are there, and is there somebody here at the hospital 24/7?
Yeah, good question. So the vet techs do play an absolutely critical role in everything that goes on here at the hospital. We rely on them for everything from patient care, hospitalized patient monitoring, procedure assistance, pharmacy work in terms of filling prescriptions, lab work in terms of running our blood. They do most of the dental cleanings on our animals, vaccine administration, just list goes on and on. So they really are just a crucial part of our team here at the hospital. We have 6 full-time veterinary technicians on staff here at the hospital, and then we've got 5 additional part-time employees that work on a less routine basis for us as well.
Hang on, I just had another one I was going to ask. Oh, are there any animals currently on any kind of like seizure medication? Is that something common that animals suffer?
That is definitely something that we see here and there. So epilepsy in people also occurs in animals. It's something that we see here and there in different animal patients. So seizure medications basically decrease that seizure threshold so that an epileptic animal or an animal with some sort of brain problem does not seizure as often. And when necessary, we do use those same medications that we would use in a dog or in a person.
What kind of medication would you give to an itchy horse?
Well, that's a tough question to answer. It really depends on why the horse is itchy. So that's one where we really would have to step back and do some diagnostics to figure out what was going on with that particular animal. Whether it was allergic reaction to something in the animal's environment, if it was a reaction to some sort of parasite or insect that was biting at the animal, we would really need to work through some diagnostics there to figure out what the most appropriate treatment would be.
We have a lot of geriatric animals here at Brookfield Zoo. Is there any kind of special, like what do you have to do to make sure that they're comfortable? And
yeah, that's a great question. So the geriatric care of our animals is something that we spend a lot of time on. So many of the animals here at the zoo live longer than they would in the wild, and that's because of the great medical care that we're able to provide them. In the wild, an animal that is sick or has arthritic changes and can't move as effectively, it either is not able to get food as effectively, it's not able to hunt prey, or it's not able to forage as well. And those animals either end up dying from the direct effects of the age, or they end up becoming prey for another animal. But here at the zoo, in the environment we're able to provide for our animals, we're able to help them through a lot of those processes, and a lot of the geriatric or old age diseases that occur, we're able to treat. So we treat things like heart disease, we treat things like high blood pressure, the ocular issues that we talked about a few minutes ago in terms of glaucoma and cataracts. We can provide provide pain medications to keep degenerative changes within their joints from being painful. So an animal with arthritis that develops over time, we're able to keep that animal comfortable with pain medications. So it's a big part of what we do on a daily basis, is providing that care for animals as they get into their sort of golden years, as I like to call it, and making sure that we keep them comfortable and healthy.
We saw that a lot of animals actually get medication that's common for humans to get. So if someone has a sick dog or cat at home, should they just go out to Walgreens and buy something?
Yeah, that's a great question. So that's something we really need to be very careful with. So there's a lot of animals that we are able to provide human medicines for, but there's a lot of animals where those human medications can be really harmful. So Tylenol is a great example, where Tylenol is a very safe medicine that we see in people all the time. And we'll use it in our gorillas and our apes because we're very closely related to people and that drug is very safe. But Tylenol in a cat, on the other hand, can cause really severe toxicity at a very low dose. So Tylenol is something that we never want to give to a cat. And that extends to our big cats here at the zoo. We would never use Tylenol on a lion, for instance. But there are other pain medications that we can use instead of Tylenol. So that's always a conversation that needs to be had with a veterinarian. So if you've got a sick pet at home, always talk to your veterinarian before trying some sort of treatment on the animal, because we don't want to see anybody end up in a situation where they're trying to help an animal and inadvertently cause harm to that animal.
We did see some hairball medication up there. So do the big cats like the tigers get hairballs?
Yeah, that's a great question. So a couple different products here as far as hairball medicine. This one's catnip flavored, some laxatone products. We do see hairball issues in some of our animals, just like we see it in domestic cats. We've got a fishing cat here at the zoo that tends to have some problems in that same regard. And we treat them the same way. So it's just kind of a regular treatment to prevent issues from developing.
Do human doctors help out with the animals?
They do. So we rely on a variety of both physicians, human doctors, as well as a variety of veterinary specialists. So just like I'm a veterinarian that's specialized in zoo and wildlife medicine, there's veterinarians that are specialized in cardiology, ophthalmology, neurology, dermatology, all the same specializations we see for people. And we've got a wide network of colleagues that we call on for specific issues with our animals. If it's a gorilla, we may be more likely to call on a human physician that's been able to specialize in that area. If it's a rhinoceros, we may be more inclined to talk to somebody that's a veterinarian that works with horses a lot, because rhinos are very similarly related to horses in a lot of regards. Some of you may have seen Ben the orangutan that we did an appendectomy on about a year and a half ago now, 2 years ago. That was a great case where we were able to work with Amita Healthcare to bring in one of their surgeons to help us with that procedure. Obviously, removing an appendix is something that they do multiple times a day in the human medical field, but for us here at the zoo, it's not something that we do routinely. So being able to work with physicians to provide that specialized care really helps us provide the highest quality medicine we possibly can.
How would you medicate reptiles?
Reptiles are often the same way we do with any other animal. So we'll try and hide it in food items wherever possible. That can work really well with a lizard that's willing to eat a cricket every day. We can put the medicine inside of the cricket and the lizard will eat it. It can be a little bit more challenging with a snake that may only eat once a week or once every month. It can be harder if we feel like that treatment needs to be administered more regularly. So in those cases, those animals are usually hospitalized. Our vet techs provide daily care for the animal, and basically we would just be opening up the mouth and giving it a pill or a liquid suspension on a daily basis if needed.
What's the most unique trick you've had to come up with to get an animal to take its medicine?
Oh, the most unique trick. I might phone a friend on this one. Michelle, Marianne, do you guys have thoughts on this one?
What?
The most unique trick we've had to use on an animal to get it to take a medicine?
Just trying different food items.
Yeah.
It seems to be, and sometimes it's sleight of hand and switching them out at the last minute and outsmarting them, which is sometimes really hard to do.
Yeah.
I know sometimes when people have to take really big pills, for antibiotics or something, they refer to them as taking horse pills.
Yeah.
How big are horse pills actually in real life?
So let's see, what would we have that would be a good example of that?
Give that a jump.
Probably the biggest we've got in stock, right?
Because the animals don't like the really, really big horse pills. They would prefer to take a bunch of small ones as opposed to one large one.
So this is probably the biggest one we've got. They do come bigger than this. We just don't have good luck with getting our animals to take them. But I've seen tablets for cattle that are, you know, the size of my thumb, basically. These are the biggest ones we use here. These are kind of neat too. You know, this is basically a gel cap. So this is basically for our purposes. In some of our animals, we'll weigh out the powders and basically make our own gel caps for our animals. And these come in a variety of sizes. So this is sort of the other end of the spectrum there with a little tiny. Whoops, I just broke that one. But a little tiny one here for some of our smaller patients where we may need to take something that comes as a bigger capsule, and our techs may grind it up and crush it down into a powder, and then we'll pack them down into the smaller capsules there.
Okay, so what you're saying is sometimes we have bigger pills than the horses.
Yeah,
okay.
That's true. Yeah.
Who's probably the most surprising patient that you've had to medicate? Like, what would you think a certain animal wouldn't actually need, but they do? Does that make sense? I don't know if that makes sense.
Surprising medicine. Gosh, that's a good question. I don't know that I've got a good answer to that one.
Oh no.
The what?
Tarantulas?
Tarantulas, yeah, we've had to treat tarantulas. That's probably one that most people don't think of. So in those cases, it's usually in a food item, or in some cases, a topical medicine. We've had some frogs. This is a good one too. We've had some frogs that we had some mites that were basically off of the substrate that we were putting into the exhibit. So like the moss that we put in had some mites that got into it, and we actually were treating the frogs with selamectin, which is a cat product. So that's the same thing we use for ear mite prevention in cats. So some of you at home probably have a cat on selamectin. And we were actually taking a very, very small amount of that out of the ampules and diluting that out and doing a topical administration on I guess they were toads actually, not frogs, but doing a treatment on some toads for the mite issues. So I think we're going to stop here. Thank you all for joining us today. We always love welcoming you into the animal hospital and giving you a little look behind the scenes of what goes on here on a daily basis. So we hope you'll be back tomorrow as we bring the zoo to you, and we look forward to seeing you all out here soon as we get back into better weather here in the spring and summer.